do is I'm going to check the doctor's written order, do my set of preliminary actions. I've already checked the doctor's order, and I'm going to gather all of my necessary equipment. When I come in, I'm going to maintain patient safety, privacy, and dignity, pull the curtain back, raise the bed up to a height that's appropriate for me. And at this point in time, I'm going to already gathered my general survey, which is a health history, a set of vital signs, temperature, pulse, respiration, and blood pressure. Upon walking in, I'm getting an overall appearance of the patient, which the patient is calm, cool, and collected, and they look like their manner is appropriate for the situation. So first thing, hi, my name is Tori. I'll be your nurse for today. Can you tell me your name and your date of birth?
Yeah. Sean Thompson, January 31, 1985.
Very good. So I'm going to be performing a physical assessment on you today. It'll be taking about 15-20 minutes of your time. Do you need to use the restroom before we begin?
No, just one. Thank you.
Okay. So the first thing I'll be assessing is the neurological. And since he's able to communicate with me, his level of consciousness is awake. Do you know what day it is today by chance?
Today is Friday, July 12th.
Okay. And do you know why you're here?
Yes, for a physical assessment.
Okay, very good. So his A and O's are ×4, so there's no need for a Glasgow Coma Scale or a mini mental examination. While I'm talking to him, I'm assessing his mood, manner, affect, and speech. Is your primary language English?
Yes, it is.
Very good. So his speech is communicable. There's no hindrances or anything like that. And like I said before, his mood and manner is appropriate for the situation. Okay, so the next thing I want you to do is I want you to grab my fingers and squeeze. Okay, go ahead and let go.
Okay.
And upon releasing, I assess motor function, which is as expected. Next thing I want you to do, push down for me,
Yep.
push up.
Mm-hmm.
Very good. So the grips were equal bilaterally, and then the plantar flexion was also equal bilaterally. So after that, I'm going to go ahead and go into the HEENT assessment. First thing I'm going to be assessing is the head. Basically, I put on some gloves. Basically, I'm looking for any kind of lesions, abrasions, any kind of baldness, patches, infestations, which I don't see anything. Next, I'm going to palpate. Do you feel any kind of pain?
No.
Okay, very good. So the next thing I'm going to go into is the eyes. You could just sit on the edge of the bed.
Yeah, absolutely.
The first thing I'm going to be looking at before I do anything is, do you wear glasses or contacts?
I don't.
First thing I'm going to be looking at is position and alignment. I want to make sure that the eye lines up with the eye figure, and it does. Then I also want to check, can you close your eyes when you open them? Very good. So there's nothing wrong with the eyelids. There's no any kind of crusties or lid lag or ptosis. So the next thing I'm going to be going into is PERLA, which is pupils equal, round, reactive to light, and accommodating. When I'm looking, his pupils are about 3 millimeters, normals 3 to 5. And so what I want you to do, and they're equal and they're both round, what I want you to do is look at my left shoulder blade. I'm going to be flashing it twice to see if it constricts equally. Okay, and it constricts down to about 2. While I was looking at the eyes, I didn't see any kind of nystagmus or twitching or anything like that. So after the eyes, we're going to go ahead and go into the ears. The first thing I want to look at is to inspect to see if there's any kind of lesions, bumps, anything like that. And I'm going to palpate. Do you feel any kind of thing?
No.
Very good. Upon inspection, I don't see any kind of buildup of wax or accumulation. Do you have any discharge or any drainage? The next thing I'm going to be testing is acuity, so I'm going to do a whisper test. I want you to plug your left side. I'm going to whisper a 2-syllable word. I want you to repeat what I say.
Summer.
Very good. And I'll be doing the same on the other side. 2-syllable word.
Winter.
Very good. The next thing I'll be inspecting is the nose. Can you just tilt your head back for me? Okay, very good. I don't see any deviation of the septum. So I want to test your nose with patency. Can you close one side and snip up? Very good. Can you close the other side and snip up? Very good. Do you have any kind of congestion?
No.
The next thing we do, I want you to close your eyes. It'll be a sense of smell. Close your eyes and close one side. Can you smell this alcohol?
Yes, alcohol.
Okay. Can you smell this as vanilla?
Vanilla.
Very good. So sense of smell is fine. And the next thing I'll be going is the lips. And when I'm inspecting the lips, I'm pretty much looking for lip color, moisture, ulcers, or cracks, and I don't see anything in the lip color is pink. So I want you to show me, smile. There we go. Okay, the teeth look nice. Can you open your mouth for me, please? Okay. So I'm inspecting the oral membrane, the gums, and the teeth, and you can close your mouth. I didn't see any kind of dental caries. I didn't see any lesions on the oral membrane or the gums. I didn't see any kind of inflammation. So at this point in time, I'd be using a tongue depressor. Can you stick your tongue out and say ah? Ah. Very good. So the uvula rises midline. There's no deviation of that. Can you swallow for me, please? Do you have any difficulty swallowing at all? Very good. And how often do you, what is your dental hygiene regimen?
I brush twice a day and floss once a day.
Very good. So the next thing I'll be going into is skin. And you can do skin throughout the entire assessment, but for the sake of this, I'm just going to do it now. So the first thing that you do is you just get an overall appearance. The patient seems to have fair skin. I don't see any kind of abrasions, lesions, or anything like that. So I'm going to check color, moisture, texture, and temperature. And like I said, it looks fair. It feels warm. There's no kind of coldness or anything like that. And the skin was smooth, so I didn't feel any kind of plaques or anything like that. The next thing that I want to do is I want to check for vascularity, so I'm just going to do a capillary refill. And it's less than 3 seconds, so there's no cause for concern. Since we're doing, and I would also do the toes, but he's wearing tennis shoes, so we'll just go on the fingers. Are you doing the fingers? Can you do this for me?
Mm-hmm.
Okay, this is called nail clubbing. I'm seeing, okay, you're fine.
Okay.
They don't touch, so there's no sign of hypoxia. Also, while I'm down here, I want to check for edema to see if there's any kind of pitting, and there isn't. The other thing I want to check for is to see if the patient is hydrated, so I would do skin turtle, which is most appropriate under the clavicle. And it doesn't stay rise, so it just shows that the patient is hydrated. So after skin, I'm going to go ahead and go into the respiratory. First thing I want to ask you, do you have any history of smoking?
We don't.
Very good. So at this point in time, I gather an oxygen saturation. Then the next thing I do is inspect. Can you take a couple deep breaths from me, please? I'm inspecting the breathing pattern. He doesn't look like he's struggling or anything like that. I see symmetrical chest rise and fall. Do you have a cough? And if you do, does it have anything with it?
No, I mean, I have a cough, but I don't have any. It's not productive.
Okay, well that's good. And do you feel like you have any shortness of breath?
Mm-mm.
Okay, very good. So the first thing I'd like you to do is, could you stand up for me, please?
Sure.
And I want you to face that way. The first thing I'm going to be doing, it's palpation. It's called tactile fremitus, and basically you're using the side of your hand and you're feeling for vibrations equal on both sides.
Or
So-
the palm of your hand.
Or the palm of your hand, the palm of your hand, the top, bottom,
There
or the
it
side.
goes. There goes the battery.
So what you want to do is you want to get a couple of regions. Basically, as soon as when I put my hands down, I want you to say 99 every time, okay?
Okay. 99, 99, 99, 99, 99,
Thank
99.
you. Lovely.
After that, we're going to go ahead and do diaphragmatic excursion. This is just to make sure that the lungs expand equal or symmetrically on both sides. So I just want you to take a deep breath from, please. And then the sums
Lovely.
will separate. Okay, so you can go ahead and have a seat. Or just kidding. I need to percuss. Percussing is important. So when you're percussing, you're looking or you're hoping to hear resonance. You don't want to hear any kind of like if the lungs are full of like gunk and stuff like that. So in the same pattern that you would auscultate, you just start at the top. And you want to make sure it's a ladder formation. About 8 to 10 places.
Good.
Okay, very good. And I heard resonance in all spots. So the next thing you're going to be doing is auscultating. The importance of auscultating, you're listening for the bronchial, bronchiovesicular, and vesicular regions. I don't want to hear any adventitious sounds like wheezing, bronchi, or crackles. So every time I put my stethoscope down, I want you to take a deep breath in through your nose and out through your mouth. You still with me? You're not sure to breath or anything?
I'm alright.
I just want to make
That's
sure I
good.
don't want you passing out.
Continue down in an organized pattern around to
Continue
the
down
sides.
an organized pattern. Basically, you're going
Yep.
here, here, and then 2 on the side.
Very good.
Okay, you can go ahead and have a seat now. So the next thing that I'll be covering is the cardiac. Upon inspection, I assessed color. There's no sign of cyanosis, and I don't see any kind of aortic bulging. So the first thing I'll be going into is auscultation, and I'm going to be auscultating the cardiac landmarks. There's 5 of them. The first one, and I'll explain it as I place my stethoscope down. The first one is the aortic landmark, which is the second intercostal space, right sternal border. So you find that, so it's right there. And then after that, after you would hear, you move on to the pulmonic, which is second intercostal space, left sternal border. Erb's point, which is the third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And then mitral, which is the fifth intercostal space, mid-clavicular line. And while I'm listening to see if I can hear any extra sounds, murmurs, S3 and S4. When I listen to the mitral is also the apical pulse or the point of maximal impulse. You will hear the S1, the loudest there. And then at the aortic, you hear the S2, the loudest. And at Erb's point, you should hear S1 and S2 equally, and if one's louder than the other, then there's a problem. After you listen, then you're going to palpate the peripheral pulses, and you want to do these bilaterally to make sure that there's no weakness on one side or anything like that, except for the carotid because you don't want them to pass out. That's a bad sign. So the first thing you do is the temporal, carotid, and I have already listened to the apical pulse when I listen to the mitral. Then you do the brachial. I'm a grabber. You can grab your patients. It's okay. Feel for the Awesome. Then the ulnar, radial, and the femoral, but we'll skip that one for now. Then you do the popliteal. Very good. And then you do the posterior tibial, kind of just wrap 3 fingers around that to make sure you feel it. He's wearing tennis shoes, but then you would do the dorsalis pedis, which is right between like your big toe and then the second toe. It could be about that far along, but it's very light palpation. You don't want to press too hard. And since I've already checked color and temperature in the skin, so there's no need to assess that again. I've already checked edema, there's no need to assess that again. And I've already checked vascularity, so there's no need to check that again, or capillary refill. So at this point in time, I'd be doing a DVT, deep vein thrombosis assessment. The Homan sign is frowned upon, so what you want to do is you want to look to see if there's any deviation in size. You could just take a tape measure and measure the calves. You can inspect to see if they're red. I don't see any kind of redness. It doesn't feel hot. Do you feel any pain in your calves at all?
No, I don't.
You're very good. So after the cardiac, then you go into the gastrointestinal, and basically the inspection part is an interview. So, let's talk. Do you have any difficulties chewing or swallowing?
No.
Okay. Do you have any kind of indigestion?
Mm-mm.
Let's see. What do I want to ask next? Have you had any changes in your diet, food intake and output, or any changes in your appetite?
No.
Have you had any recent weight loss or weight gain?
Mm-mm.
Do you have any constipation or diarrhea?
No.
Well, that's good. When was your last bowel movement?
This morning.
That's good. Alright, so the next thing I want to do is I want to have the patient lay on their side or their back so I can inspect and auscultate and percuss and palpate the abdomen. First thing you want to do before you do anything, you want to get on eye level with the abdomen to see if there's any kind of distension, and there isn't. Next thing you want to do is auscultate because you don't want to stir up the belly after from percussing and palpating. So basically, you're going to divide the abdomen into 4 quadrants: right lower, right upper, and left lower. And I'm going to be listening to see if there's any gurgles. Usually it's 5 to 30 gurgles per minute. You want to make sure that it's active, not hyperactive, hypoactive, faint, or absent. I'm just going to place my stethoscope down so you can see it. It's basically you start down here, listen for a couple of things. Move it up, listen, over, listen, and down and listen.
Good.
Then after that, the next thing you want to do is percuss. And you're doing the same thing like you did on the back, only you're listening for tympany over the colon and the stomach, because all of a sudden it has kind of settled down, so you'll hear air. The only place you should hear dullness is the liver. If you hear dullness, anything else, it could be a blockage or anything like that. Basically, what you can do is you can go into Christmas tree shape pattern to make sure that you hit all the spots. And I can just
Good. Fine.
and then after that, you're going to palpate, and you're going to palpate in the same manner that you would percuss. You're doing a Christmas tree shape. You're feeling for any kind of superficial masses, and while doing that, you're going to be looking at the patient's face because you don't want them to be making like grimaces and stuff like that, so you'd be doing it in the same manner. You still with me? Okay, I'm just making sure. Okay. And if you have anything that would be cause for concern. While I'm already in the gastrointestinal, I'm going to go in the genitourinary. So the first thing I want to ask a couple questions. Do you have any difficulties urinating?
No.
Okay, how often do you urinate?
About once every hour, every couple hours.
What color is it usually?
Clear.
And do you see anything like floating in there?
Mm-mm.
Okay, very good. And then at this point in time, you could palpate the bladder. Since he's already gone, you would just feel if it's like distended or if there's bulging. If it still feels full, then he could have possible urinary retention or something like that. And the anus, genitalia, and rectum are deferred for students, so I'm not going to be. You're safe. I won't be doing that for now. Okay, so the last thing I want to do is the musculoskeletal. The first thing you want to ask is, do you have any kind of history of falls?
I do not.
Excellent. Can you stand up and walk for me, please?
Sure.
You just walk to the end table.
Yeah.
At this point in time, I'm assessing posture, stance, gait, and swing. They all seem as expected. While you're standing, I'm going to go ahead and do a spine curvature test.
Okay.
So you grab the patient by the hip and you ask them, can you bend over for me, please?
Mm-hmm.
You feel along the spine and see if there's any deviation, and there isn't, so you can go ahead and stand back up.
Okay.
While you're standing, you turn and face me.
Okay.
What you want to do is you want to get a range of motion to see if they have any difficulty or anything like that. So put your arms up,
Mm-hmm.
up to the top,
Yep.
out in front of you, behind you. Any pain?
No.
Can you lift your legs for me?
Yep.
No pain, no stress, no nothing? You're just healthy now, aren't you?
Yeah.
Okay, so after the range of motion, I'm going to go ahead and do muscle tone and strength. So I want you to put your arms out for me.
Mhm.
Push up,
Mhm.
push down.
Mhm.
You can go ahead and have a seat now.
All right.
Do the same for the legs.
Okay.
You can pull back, push
Mhm.
out.
Yep.
Excellent. So the muscle tone is about a 3+, which is normal, or as expected. After that, you can ask them, do you have any kind of pins and needles?
Mm-mm.
Do you feel any numbness, coldness?
Mm-mm.
Do you feel like your muscles sometimes stick, muscle contractions?
No, no problem there.
Do you have any difficulties performing your daily living activities?
No?
Okay, very good. Alright, so that's it for the assessment. The next part is more of just questions, psychosocial, cultural, teaching, stuff like that. Have a seat again. So how's it going?
Good.
Okay. You happy with your life?
Yes, I am.
Do you have a good support system at home?
I do, yes.
Okay, very good. Do you feel safe at home?
Mm-hmm. Yeah, absolutely.
Okay, very good. Have you ever thought about harming yourself or somebody else?
No.
That is very good. Is there any kind of cultural or religious practices that we need to be aware of to make your stay more comfortable?
No, I don't think there'd be anything in particular.
So, and then is there any kind of diet modification that we need to be aware of?
Mm-mm.
Okay. Since the individual is pretty healthy, I would promote health and wellness. I would also, I would encourage the patient to have, to make sure that he does breast exams every month, testicular exams every month, and just overall skin examinations to make sure that there's nothing abnormal that would be cause for concern. So last thing, do you have any questions, comments, or concerns for me?
No, I don't have any.
Okay, very good. So, at this point in time, I'd be doing the concluding actions. I'd be lowering the bed back down, raising the bed rail up. I'd be giving the patient the call bell. I'd be pulling back the curtain. Basically, thank you for your time.
Yeah, absolutely.
And so I wash my hands, document, and then reassess as needed.